Popping pills and going under the knife are not the only way to alleviate pain and feel good every day. Here to explain alternative options is Dr. Cecil Graham, Medical Director at Catalyst Pain Solutions. Great to see you this morning.
Gina, it's good to be here.
So we are hearing a lot more about opioids, addiction, even deaths. Can you speak a little bit to that issue?
Well, narcotics, the bottom line with narcotics, they affect your perception of pain at the brain. So the underlying issue is it's not doing anything to treat the cause of the pain.
Right.
Healthcare has gotten so out of control in this country, and especially with some of the things that are going on now with the previous administration and all that. Procedures and that kind of stuff is hard for people to get. It's the deductibles and that kind of thing are just so out of line. So people are being given narcotics just as Band-Aids to other things that they really need to have done.
All right, and tell me a little bit about how Catalyst Pain Solutions takes a different approach to treating pain.
Well, our administration at the very beginning, when they formed the clinic, said we want to treat the cause of the pain. We're not going to be a pill mill. So we do not write prescriptions other than for 1 or 2 days pre and post procedure, and that's it. So no long-term maintenance of narcotics. We're not, you know, once it leaves the physician's office, a prescription of narcotic, we have no control over it. You know, you don't know what patients are doing with the medication. So we just totally stay away from it.
Well, and let's go back and take a look at some of the statistics from the Arizona Department of Health Services on this opioid use and what's happening in our community.
Well, and as you look at those numbers, they're not, people tend to think of, when they think of narcotic abuse, they're thinking of the people out on the street, the homeless and the heroin addicts and all that. These statistics are your next door neighbors. You know, they're your spouses that are being, you know, given medications, and then they just keep getting those medications over time. So there are switches from being a useful pain component to just using it to feel good. And when that transition takes place, you lose control over it. But it can happen to anyone. There's no one that's immune to that effect.
And tell me a little bit about how Catalyst Pain Solutions procedures are so unique.
Well, we do, you know, we're doing a lot of regenerative stuff now with bone marrows and stem cells, which is so exciting because we're healing problems. But we also attack things with non-steroidal approaches. And that's probably our main thing, because we have 50, 60 years of data now in the United States with how steroids work. You know, they suppress the inflammatory response in your pain, but it also is detrimental, you know, adds to the degeneration of your cartilage in your hips and knees. So now we know we just want to stay away from that.
Wow. And tell me a little bit about what you want people to take away from this today, what you want them to remember most.
I think the main thing is we go after the cause of your pain. We're just not hiding it from you. We want to go and treat the cause. If we can cure the cause, of course, that's our goal.
And you treat all types of pain at Catalyst Pain Solutions.
We do everything. We're physician-based. We do, you know, history, physical. We do MRIs, anything you need, from headaches, spine is really our specialty, but joints. But we're a multidisciplinary pain clinic.
All right. Well, thank you so much for being here today and for all the great information.
Thank you.
And if you would like to learn more about Catalyst Pain Solutions, visit them online at catalystpainsolutions.com or call the number on your screen.